Your baby at 1 month. Congratulations, you survived the first month and you should be feeling more confident about parenthood. Over the first few weeks, you will have many questions about your baby and your parenting. It can be tempting to Google and find out answers to all the questions and concerns you may have, but beware of false news and misinformation, which can be dangerous and harmful for you and your baby. I'm Dr. Gina, and over my 15 years career as a paediatrician, I have managed thousands of newborns and babies and have helped parents navigate those tricky first few years. For more evidence-based videos on child health and parenting, please like, subscribe, and turn on notifications. In this video, we will discuss exactly what to expect when your baby is a month old in terms of crying, sleeping, feeding, and development. Crying. Your baby will be crying more as this is the main way they communicate now. They may be hungry, wet, tired, or just bored. If you listen very carefully, you may be able to decode the different cries your baby has and what they mean. Sleeping. Your baby will still be needing around 14 to 17 hours of sleep in a 24-hour period. And they will wake every 2 to 4 hours to feed. Always place baby on their back to sleep in a safe sleeping environment to reduce the risk of SIDS, sudden infant death syndrome. You can introduce a pacifier to baby for naps or nighttime sleep. If you are breastfeeding, it is best to wait until they are 1 month of age. Pacifier use can actually reduce the risk of SIDS. Use it to help soothe baby and take it out once they are asleep. Feeding. Your baby's stomach is growing and so is their appetite. How much you feed varies, but should be around 5 to 750 mils per day. Close monitoring by your doctor or midwife can help ensure your baby is putting on plenty of weight. By this age, they should be gaining around 180 to 250 grams per week. As your baby goes through growth spurts, you may notice them feeding more often or cluster feeding. These growth spurts only last a few days whilst your milk supply adjusts, and then baby will settle back into a regular pattern of feeding. Pooping. How many dirty nappies baby has will vary from a few each day to once every few days. As long as they are soft, then there is no need to worry. If you notice blood or mucus in the poo, this could be a sign of cow's milk protein allergy or other allergy, so ensure your baby is reviewed by a doctor. Development. Physical development. Baby will still have weak neck muscle, so you will need to support their heads when you are holding them. You can start introducing supervised tummy time or playtime on their belly. This is essential in helping them develop those important motor skills like lifting their heads. Initially, they may only tolerate a couple of minutes a day, but gradually you can build up. At this age, they are still very uncoordinated with their movements, but ensure they are using both sides of their bodies equally and do not favour one side more than the other. Speech and language. Your little one will be making lots of cooing noises and should still be occasionally startling to loud noises. Vision. Their vision is very fuzzy. Sharp contrasting colours like black and white patterns really stand out to them. Social development. In the first few months, baby needs responsive parenting, which means they want to be with you all the time. This is a normal, vital developmental phase needed to help establish bonding. It is still too early to introduce a routine at this age. That amazing bond that parents feel does not always happen straight away. It can take a few days or even weeks, and this is completely normal. However, if you are feeling particularly low, then do go and see your doctor. Having a baby is one of the biggest challenges you will ever face in those first few weeks and months. Everything will be new and scary. But as you get to know your baby, your confidence will grow. You should see your doctor or midwife if they have any of the worrying features discussed in this video. Most of the time, everything will be absolutely fine, but early identification and intervention is vital. I'll see you next time when we discuss your baby at 2 months. Bye.